Welcome to my presentation for the 2025 International Congress for Qualitative Research and Theory Methodologies. My name is Dr. Susan Steele, and the title of my presentation is The Essence of ICU Nurses' Experience During the COVID-19 Pandemic, Then and Now. The objectives of the presentation are to relate Watson's theory of human caring to nurse-patient relationships during the COVID-19 pandemic, to understand the essence of the ICU nurses' lived experience during the COVID-19 pandemic and after the vaccination actually was founded. And then third, to apply the knowledge gained to academic and clinical settings to continue to support practical nurses. Just a little bit about myself. First, I'm a statistician and research methodologist at Northwestern State University, which is located in Natchitoches, Louisiana. Natchitoches, Louisiana is located approximately 2 hours north of Baton Rouge, which is the state capital of Louisiana. I also serve as a research consultant and adjunct faculty for Grand Canyon University, which is located in Phoenix, Arizona. And as you can see, both of these are located in the USA. So the problem statement that was addressed in this qualitative research study was that there was little known about the lived experience of the registered nurses caring for ICU patients diagnosed with COVID-19, both before and after the vaccination was disseminated. The purpose of this qualitative phenomenological research study was to understand the lived experiences of the registered nurses caring for ICU patients diagnosed with COVID-19 in Louisiana, USA. Watson's theory of human caring was used as a study framework. And for those of you that are not familiar with Watson's theory of caring, she basically believed that we should look at humanity as a valued person within themselves, that health is a high-level overall functioning being, that we should have a caring attitude that transmits and transcends all other aspects within the profession. And that as nurses, we promote health, we prevent illness, we care for the sick, and we restore health. And while her primary focus is on health promotion, she also looks at nursing as the conduit to healing within the acute care setting. So she says that transpersonal caring seeks to connect with and embrace the spirit or soul of the other through the process of caring and healing and being in authentic relationships and being in the moment. She also believes it is when we include caring and love in our science, we discover our caring and healing professions and disciplines are much more than a detached scientific endeavor, but a life-giving and life-receiving endeavor for humanity. And as we begin to talk about some of what happened with some of the nurses, you're going to see the conflict that they had within their nursing being and how they were having to let go of patients. It was definitely very hard for them. So the study was approved by a local university, and all the nurses did sign informed consent. Of course, their names were blinded, and the nurses during the interviews were on Zoom. The nurses could choose to use their camera or not. And they could choose to change their name on their camera to protect their identity. And some of them chose to do that because some of the things they shared that they witnessed, they didn't want like to come back on them, or also they didn't want like other people to be able to link what they said to a specific hospital in this region. And the content was approved by all the participants before it was included in the presentation. So the recruitment was done within one acute care facility, but the nurses were speaking of occurrences that happened with them from 4 different acute care facilities within the state. And they were all employed in ICU or step-down ICU units at the time that they were sharing their experiences. And they all managed COVID-19 patients both before and after the vaccine was disseminated. And there were 10 participants, 3 were female and 3 were male. And there was a pediatric nurse, but he wasn't included because initially we were going to do a study with adult nurses, then we were going to do a study with the pediatric nurses. But when it came time to do the study with the pediatric nurses, they basically told their clinical nurse specialist that they didn't want to remember those times during COVID because when I collected this data, it was about 3 years after COVID had abated. So they didn't want to really relive those experiences, and so we never completed the pediatric portion of this study. So the method and design, it was a qualitative method using an interpretive phenomenological design where we looked for detailed exploration of the individual nurses' experiences and how they explained their experiences and it helped them to make meaning of their world. And we looked for contextual features of their experiences and how it affected the phenomenon. And we assume that people are self-interpretive beings. And I think you're going to see in the stories that they told how, in reflecting back, how some of them had a new recollection that they hadn't even thought about at the time. But then in retelling their stories, how a new perspective kind of emerged. And phenomenology is anchored in the research tradition of trying to understand what it was like to walk in their shoes. And it provides a deeper understanding of the experience, especially those of us that were not at the bedside at the time. And so, I kept a audit trail where at the end of each interview, I kind of reflected on what they said. And I had to personally really be aware of my own feelings. Some researchers say you can't bracket your feelings, that your feelings kind of provide a lens by which we view qualitative research. And for me, my lens was during the AIDS epidemic. So I was taking care of patients when AIDS first became problematic back in the 80s here in Louisiana. And that was when we didn't know what it was. We didn't know how it was spread. And all the nurses basically were scared of it. And a lot of the stories that the nurses told really resonated with me because I remembered how I felt and how my colleagues felt kind of during that whole AIDS epidemic. And, I had to really listen to the recordings multiple times because while I acutely remembered the stories that they told, just that re-listening and that re-immersion really helped me to really hear their voices. As I said, some of my experiences could have overshadowed their voices, and I wanted to be sure that it was their voice that came out in the report, and that it wasn't clouded by my own perceptions. And so again, I reflected on the essential themes that categorized what they were saying. And I kind of came away with each interview with some specific thoughts about what were the key important facets that was within the story they told. And I kind of jotted notes about that so that when I went back and listened to the interview later, I could remember what some of my first perceptions were right after the interview was finished. And then I looked for the key elements that the nurses captured within their individual narratives. And you know when I transcribed the interviews, I shared them with each of the nurses. And interestingly, they received a Amazon gift card for participating in the interview. And I can't tell you how many of them said, I wanted to tell my story so that my story got out because nobody really cared what we went through. And they didn't do it for the gift certificate, which I found very interesting. Um, And they wanted me to donate the gift certificates to the local children's hospital in town. Many of them chose not to take the gift certificates. So I found that very, very interesting. So here we have a word cloud of some of the important words within their stories. And of course, they talked a lot about seeing those patients as people, not sick people in beds, but as persons with lives and families. And most of you'll remember back during that time, the families weren't allowed to visit. They could only visit on an iPad or a video call. And so it's not surprising that that us seeing them as things, like things to be had versus people, and that's going to come out a lot. And obviously patient, because we're talking about patients, so patients are going to be a main word. And you just see here some of the predominant words that came out in their interviews. So there were four themes that emerged from the nurses' stories. The first one is the calm before the storm. The second is we're not heroes. We can't even save these people. They are forever in my mind, and nursing is forever changed. So the calm before the storm actually comes from a weather phenomenon that we have here in the South. It also affects the eastern coast. And basically what it is if you know a hurricane is coming, like you see the hurricane coming towards your state, right? You know it's coming, but you're in your present state, your skies are blue, there's no wind, there's no rain, there's nothing. But in the back of your mind, right, you know it's coming. And so they talked about the calm before the storm. Like they saw it happening in other parts of our state. They saw it happening in other states close to us, but it hadn't hit Baton Rouge, Louisiana just yet. And so the nurses spoke about like not really knowing when the virus was going to hit Louisiana. And each time that a wave came and it sort of kind of died down and went away, they were always fearful that it was coming back. And even though these interviews were 3 years after the initial onslaught of COVID-19, they still spoke about, I'm still scared to death that even though we had the vaccine, that a new variant's going to come and this whole thing is coming back again. So it had affected them so much that they really couldn't even let go of it even 3 years later. And even though the waves were far apart, they were not willing to let down their guard. And I think you're going to see that in their stories. And so here's one of the first stories. Early on, we were seeing these patients. They were just so sick, and nobody really could understand what was going on with them. They had pneumonia, and it was just these one-offs, right? So it wasn't like a heavy influx of patients. And then, of course, we started seeing stuff in the news, and then March rolled around. It was like I could see it coming, you know. It was almost like you're getting ready for a hurricane and you can see the black storm clouds coming. It was like we could feel it come in, like the acuity of the patients was getting higher. And on March 14th, everything changed. All of a sudden, it was, day-to-day operations to, oh my gosh, we have a COVID patient in the ER, and then, oh my gosh, we've got 5 COVID patients in the ER, just like a storm hit us overnight. And so it was literally, when I tell you, not day to day or week to week, it was hour by hour changes, right? So the leadership would come in and give us a list of things like, here are the things that we need to do. So, here's our PPE guidelines, here's their medication, all that stuff. And 3 or 4 hours later, they'd come back and say, guys, look, stop what you're doing, rework. These are our guidelines now. And so it was a very quick turnaround. I mean, no one knew that it was coming. There were a couple of times I thought it was pretty much going to be over. But it just always came back. Even though it's happened 3 times, I still think like right now, I think it's pretty much over. But a lot of nurses have been working COVID the whole time, just being like, oh no, it's going to come back. we're going to have another wave. And so I'm optimistic that it's not. But most people that work COVID with me, they all say, just get ready. It'll be back again. Every new variant that it comes out and it's spreading rapidly everywhere. And it turns out not to be true. I think it's happened just recently with this Omicron variant. I mean, a lot of people caught it, but like not many people came into the hospital for it. So it's almost like sensationalism. I remember thinking, oh God, here it is again. So I can imagine if I wasn't a nurse and I didn't see what was going on or that I'd be frightened. Oh man, they said it's worse than ever. Whenever we saw the news and stuff, and we were kind of like, well, maybe it's not going to hit us. Maybe it's one of those things like the war, when they're like, it's going to be like World War III, but then nothing happened. So we're just like, okay, well, let's see how it all plays out. Well, one day we spoke up, we showed up to work, and there was a COVID patient, and we're like, oh, this is real. So this just kind of escalated from there. Now, now we know there were surges, but in the beginning, we didn't know that that was going to happen. So they, which they're talking about administration, thought it was just going away. And then, of course, we had a surge. So when the second surge came, we realized like we're in trouble because we just didn't have enough people. We had way too many patients and not enough staff, and no one saw this coming. And there were these times when things would be like, the mask came off. And so there was that. Okay, I think we can breathe again. But it was still like, I still can't help it. I can't help it now that we've kind of, loosened on mass here. I'm like waiting for it, just the ball to drop next, like, because that's what happened to us over and over again. It was like, okay, everything's fine, but now, right now, maybe it's over. But I haven't thought that until maybe about 2 months ago. And I still kind of wonder if you know when the next wave is going to be like, because it seems like every strain has been a little different. And you don't know if a strain is going to be harder or if it's going to be just a little bit easier. And so then the next theme was, we're not heroes. We can't even save these people. And here in Louisiana, the community viewed the nurses who were working the COVID units as superheroes. And the nurses were confused by this analogy because they themselves did not feel like superheroes, because at the end of the day, they saw so many of their patients die and they really didn't help any of them. And then even after the vaccine emerged, they really didn't ever feel like a superhero. And in fact, the community turned on them when they tried to encourage people to take the vaccine. They were like viewed like the villain, like Cruella de Vil. So here's some of their stories. What was really incredible was one evening while we were walking out of the hospital at shift change, the parking lot was filled with police officers and fire trucks and ambulances. And they didn't turn on their sirens, but they had all their lights on. And some had signs with, we stand with you in unity. And it was just when you're going through that it meant so much to us. I mean, during the whole pandemic, nurses were heroes, respiratory therapists were heroes, all these heroes. I don't think a lot of people realized how much we got thrown under the bus. Doctors even threw us under the bus whenever they didn't even come to the unit to help, to even see a patient with their own eyes. People called us heroes, but a lot of people didn't realize how much we went through. They were dying all around us. We were not heroes. We couldn't even save these people. So from the very beginning, we've always been kind of that silent hero that people don't really recognize. They don't look at us as nurses, as public servants. And so it was incredible to see the communities really rally around us and come to the hospital to pray for the patients and pray for us. I'm just seeing all the support from the very beginning. And then as it became so political, there was just so much turmoil in the community between all the opinions. We're going to work every day, right? And so the nurses are sleeping during the day. They don't know what's going on the news, or going to work at night, or vice versa. And so just all of a sudden, it became like we were almost the enemy because we were in the middle of this politically charged pandemic. And so it was very unfortunate that it became so political because I think it really hurt our credibility. Just the things that we would see people post about nursing, because like we're still doing the same work. It was very interesting to see the relationships from people change. It was almost like when the vaccine first came out, it was being pushed so hard. It was like, get the vaccine, get the vaccine. And then that suddenly changed. And then when people didn't get it, then it became nurses' fault. Even nursing doesn't want to get it. And everyone has the right to get it whenever vaccine they want to get, right? But I feel like we went from the hero bucket to the villain bucket. People were like, why are you, nursing, making a big deal about this COVID? It's no different than the flu, and quit pushing the vaccine. None of us were there to be a martyr. No one had time to think about that. No one had time to think like I want to wear a cape. Nobody thought those things, right? I mean, we're in the middle of it. We're not watching the news. We're not on Facebook. We were so ingrained in what we were going through at the time, and none of us had any motivation one way or the other. All we cared about were those patients. We didn't care about any of the crap that was talked about on the news. We would hear it when we first started overnight visitation. We could hear all those differing opinions. I cannot speak for everyone, but I can tell you that when we're in the hospital, all we cared about was making sure those patients were taken care of, not what other people were doing. The third theme was they are forever in our minds. And what really struck me was how they vividly remembered, certain patients they took care of. They didn't tell stories about all of them, but there were some patients that truly made an impact on them, really in a negative way, to the point that many of these nurses experienced PTSD. And some of them talked about actually needing to continue to seek therapy, even though these interviews were 3 years after the pandemic had abated. And so the nurses spoke about these specific patients that they never could forget. And some of them had touched their hearts in just very special ways. And they talked about how valiantly some of them had fought, but then finally succumbed to the virus. And then they talked too about the impact that it had made on their family. We really got to know them. We were with them for days. It was like it was hard, It was harder for me with some of those because they've been here so long that I took care of them. In here, just because I mean these people weren't supposed to die, right? And it was very surreal walking down there with a patient. And you would bring 2 or 3 a day down there to the ICU. And you go there and everything is quiet. And you open the doors to the ICU and everyone is just staring at you with like a somber look, here's another one. You don't know if this person is going to come out of here or not. But it's not said, but it's all understood with the look on everybody's faces. And it almost gives you chills walking down there and just thinking about it, like bringing those people down there, not knowing what's going to happen to them. Their cries for help. There was just nothing we could do. They were maxed out on everything. They struggled to breathe. Their lungs were stiff. Their mouth was dry. They wanted water. They were hungry. We couldn't feed them because they were at risk for aspiration. Their mouth was so dry. I mean, it was just, we didn't know what to do. They were so hypoxic. They were just screaming for help. They're gray from head to toe. And the only thing you can do is intubate them. And now you just hope that they survive. You just have to sit there and there's nothing you can do. You have no answers. The only thing can do is just sit there and hold their hand and pray with them as they take their last breath. The fear in their eyes as they take their last breath. I cannot forget those eyes. At first, it takes a toll on you. And the sad part about it is that it became so frequent that it was just routine for us at some point. And then all of a sudden it hits you like a ton of bricks. I mean, I don't even know how many people I watched die during the pandemic. It was just unreal. So nursing has forever changed. The nurses talked about their whole essence of nursing was non-existent because everything they had gone into nursing to do um, kind of went by the wayside. Um, they also saw colleagues who were more interested in the money that they were being paid than they were about patient care. And the importance of the colleagues' mental health really wasn't at the forefront because, management was more concerned with them just showing up at work. And one of the nurses actually talked about sitting in their car before they went into work, crying, and not wanting to have to go back. And they really struggled with balancing patient care and self-care. And so these are some of their stories. People really weren't getting the nursing care they need. People were scared. The patient's entire back peeled off on the sheets. He had not been looked at or turned in more than a week. It was pretty bad. It made me almost want to do it again, but the patients needed help. And this young man was talking about a patient who happened to be a prisoner, and he was in a room where you could see the patient from the window. And during this time, they had brought the pumps into the hallway. And so the patients had central lines, and the nurses hung all of their IV meds and all of their fluids and stuff in the hallway. And so he was telling the story about how when he went into the patient's room to do his regular nursing assessment, like he always did. And that's when he found this patient hadn't been turned, and it really broke his heart. And then he said, nurses have become lazy. People take shortcuts now. People don't want to do daily baths. Like, no one wants to go back to pre-COVID. Nurses have changed. And it's like, no, guys, we're not going into the room 3 times. We go into the rooms a lot of times, and our patients need us to be there. And they were talking about, especially the nurses that came out during COVID, they were trained to only go in the room like 3 times during a 12-hour shift. Whereas traditionally in ICU care, the nurses would do assessments hourly. And so these nurses were trained that was their norm. And then as the virus started to abate and they were expected to go back to the pre-COVID nursing care, these nurses were like, "What? I didn't sign up for this." And they didn't want to actually provide patient care. Like, they didn't really want what nursing really needed to be. Another nurse shared, it's voided everything we knew of nursing. New nurses who started during COVID think they I think they lack the touch and limited interaction, which is what patient care should be like. They're immune to it, as if it's a norm. For those of us who practiced before COVID, we remember being at the bedside all the time. Now we're having to find a middle ground between what nursing was and what it has become during the pandemic. COVID definitely changed that. Like, it's definitely projected nurses demanding more money. So in the direction in that direction, it became much faster. And I think it could ever have done before the pandemic. We've gotten into this and we're all going to stick together and to demand more money because we deserve more money, that kind of thing. And she was talking about like the nurses, were trying to like band together as posses. And that if they all stuck together, then the nurses would be able to get more money, out of the hospital. Everybody jumped on the money train when traveling. It's almost to where it's a job, not a career anymore. It's just like, let me get these 12 hours instead of going to work and actually feeling like you're making a difference or doing something important. And then another nurse talked about these nurses make $120 an hour, working 60 hours a week. I know it looks enticing, but most of them were just in it for the money, and not enough of them were actually caring for the patients. And she talked about that the hospital had gone out and hired a lot of agency traveling nurses, and they were paying these ungodly amounts of money. And they were working alongside of the regular nursing staff that was just making what was called a COVID differential, but it wasn't, essentially anywhere near what the nurse standing right beside him was making. They thought they were just, oh, I'm making 3 times your salary, blah, 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 blah. And I'm not going to show up or I'm not going to do this. And the nurse said, these are still humans that we need to take care of. This isn't a simulator. This is real life. And so she really was tired of hearing, like everybody talking about money because in nursing, we went into nursing to take care of people. We didn't go into nursing because it was a high paying job, right? And then another nurse said, I understand the emotional toll that it made on my family, but to me, the emotional toll of nursing was immense. Having to rid everything that we learned to feel helpless when I'm here to save and realize that there are some I might not save. Watching family members hurt and having continued to be strong because we're the superheroes. We can't be broken because we're supposed to pull everyone through at the bedside. I don't think people realize the emotional, medical, and physical toll this is taking on us. The times we had to lean on each other's shoulders and cry, or how many of us are walking around suppressing everything we went through as if nothing happened because we don't want to be broken. We are thought of as superheroes, but I cannot come out of the fight or flight until I admitted I was broken and I was hurt and I was in an internal pain. For us, nursing will never be the same. The day that I showed up at work, I just thought, this is too much. I had my first panic attack at work. I was put in the mental health room that day, and there was a kid who was bipolar having a manic episode. His mom might have had COVID too. So it was like a double whammy. I hated the mental health part of it. And now I was exposed to this crazy new virus. I had to hold the kid down and get an IV in him while wearing full PPE. And the mom was quarantined in a separate room. It was a mess. Before I could even walk out of the room, I just felt this really heavy feeling over me. That's when I realized I was having a panic attack and I just couldn't breathe. I felt so heavy. I just wanted to lay down on the floor. So I left. I told the charge nurse and I went to the bathroom and I just had a breakdown. I just cried. People found me and I went home. I decided, yeah, I'm not going back. I thought my whole life was over. And at that point, needless to say, COVID messed with me a lot. It had a big impact and a lot of therapy and soul searching later. I finally decided to come back to nursing about 6 months after. It's like the only way for me to get over is to open up and become closer to my family. They support me by giving me space, listening when I want to talk, and not judging me afterwards. It was at that point of survival for me. I'm the only parent of my kids, and I have a job to do. I exerted every bit of energy I had, or the things I wish I could do for my family, into my patients. Nursing consumed everything. I gave my compassion, my gentleness, my energy to the bedside because that's what my patients needed in the moment. But when I went home, there was nothing left. I didn't know how to be at home anymore. I didn't know how to be a mom anymore. All I knew was nursing, save lives, being compassionate with people at work. At home, I was a rock. There was no emotion. My kids got what was left of me, not the part of me that smiled and encouraged, but the part of me that just survived. It's like COVID stripped me of that balance between being a nurse and being myself. Nursing became the only identity I had. Everything else, including my self care, my role as a mother, just disappeared under the weight of the job. So, how did this study advance nursing knowledge? It provided that there's uncertainty around every disease process that comes into being, that we don't know what caused it and we don't know how to get rid of it. And we've seen this happen with AIDS. We saw it happen with COVID. We see it with things like Ebola and other catastrophic diseases. And while they're really scary, um, what we need to learn from them is what we didn't do very well. what we did well, and how we can replicate those the next time this comes around. And we really shouldn't label nurses as heroes because, in their words, they didn't feel like heroes. They weren't really saving anybody. Granted, they were on the front line, and so people saw them as heroes. Even the police and the fire department and the ambulance staff saw them as heroes. But in the end, we really shouldn't lift people up in that way because for them, it was really sort of demoralizing. And all of them experienced some level of moral distress. I mean, you could hear it in their stories. I mean, there were nurses who cried during the interviews. Um, some just had to take a moment and stop. Like they couldn't talk about the stories anymore and recollect what they had gone through and how they felt. And they told that they still wake up having nightmares about some of the patients that died in front of them. And because of some of the behaviors that nurses exhibited during this time, and because of some of the nurses that are still practicing now, were actually graduated during COVID. um, the reason that they went into nursing, what they look for in nursing is very different than people before them. Most of the time, if you ask a nursing student, why did you go into nursing? They're going to say something like, my mother was a nurse. I want to help people. If you ask a nursing student today why they went into nursing, because I'll make a lot of money. And so that's their purpose and reasoning for being a nurse. And all of us who are nurses or have been nurses know that nursing is a really hard job. And no matter how much money in the world you're paid, it's not ever gonna pay you for the work that you actually do. And I think it calls for nursing leadership to really see their nursing staff as people, to really see that you can't have disparate staffing practices on a nursing unit, because if you hire agency staff and they're paying 3 times what your nurses who are engaged and have sacrificed for your hospital, and there's that much disparity, how do you think that nurse feels? So are you going to be able to retain them? Or are they going to say, to heck with you, I'm just going to go join the agency. I'll still be able to work on this unit, but I'll make 3 times what I make. And so, do I think that what's happening in nursing was because of COVID? Probably not. I think that part of it is just the what nurses look for today than what we looked for years ago. But at the end of the day, I don't think we're going back to how nursing used to be. And I think that COVID stripped away the certainty and the presence and just parts of ourselves. And you know, even with the faces being broken, there was a profound resilience that nurses exemplified. And for the most part, they were there for each other. Because I remember a story when one of the nurses talked about one of the nursing supervisors came in and brought them candy, and he said how much of a slap in the face that was. Like, they didn't want candy. They needed somebody to come down from administration and help them. And they were specifically angry with like supervisors and administrators who were nurses that chose not to put on a uniform and get in the trenches and help them. And so I think we have to be aware of what we expect from our nurses in what we're putting them through. And as we looked at, nursing is not going back. We're not going back to those 3 shifts I talked about. We're not going back to every third weekend off. We're not going back to $8.02 an hour, which I thought was a lot of money when I graduated in 1982. We're talking about nurses now making $120 an hour, working staffing, it was for staffing companies, going all over the United States. We didn't do that for a long time, there was no such thing as agency nursing. Hospitals hired their own nurses, and the nurses were committed to the hospitals they work for. But now the level of commitment is more to the money that nursing can bring rather than the facility that the nurse works for. So I think that, and I'm not sure how it is in other countries, and I'm not sure how it is in other states, but it certainly has become that way here. Um, where I practice in Louisiana. Here's my references. And here's just a little bit about me. If you want to contact me for more information, I have both of my email addresses, or you can call me on WhatsApp, and that's my cell phone number. So with that, thanks for listening, and I hope you got something from this presentation.